We are doing difficult noses. Here's another one for us. Now, this is a post-surgical nose. You're going to see patients in your practice who've had rhinoplasty. And one of the most beautiful things about using filler to correct the post-surgical rhinoplasty is you can do a great job. Very hard to take people back for revision rhinoplasty, and it's very hard to be super ultra precise with millimeters of correction. And I know, I'm a surgeon, I've been doing rhinoplasty for 20 years. I think liquid rhinos rival surgical rhinos in so many ways. They're faster, they're easier, they're so much more precise. Not easier, but you know, no downtime, no recovery time. So there's a lot of good benefits, and they're particularly good for post-surgical noses that need corrections that would otherwise take 2 to 3 major operations with cartilage grafting, back of the ear harvest, rib harvest. It's a lot. So always caution your patient, this has got some risk. You're a surgical patient, you have decreased blood flow, you have scarring, you have lymphedema. It's not going to be as straightforward as regular patients, but good results can definitely be obtained. So in this case, nasal exam assessment is super critical. Our patient had a rhinoplasty when she was 19, fully awake in the backroom clinic, and I think that they really over-resected her nasal dorsum. So she's got almost the beginning of a saddle nose deformity. And she's got a bulging cartilaginous hump here in the lower third of the nose. Her nose from the frontal view looks more rounded and bulbous and even a little bit foreshortened and blunted. So we have a couple challenges. We looked at her nasal angles as well. Can you turn to the side? The nasofrontal angle, which we like to see at 120 degrees, is probably 150 or 160. It's almost vertically oriented, and she's very widened in here. Her nasolabial angle here is less than 90, and we want that to come up. So we're going to do a couple tests on her. The nasal pliability test, which is a test published by Dr. Ayad Harab, and he showed that when we pinch the nose and pull downwards, we can assess, and we should assess for how pliable is the nose. 3 areas. Number 1, the radix, very pliable. So we want to only work on noses that have good pliability index because got to have room for filler. We can't choke off small peripheral blood vessels. Number 2 area to test is the tip. So I'm going to pinch the tip upwards and feel, and here she has some resistance. It's not as pliable, but when I position the nose where I want the 120 degree angle to go, I can definitely feel the tip has a small amount of room for us to work with. This is one reason I like to do 2 visits, 30 days apart. We can create space, allow the filler to hydrate, and get the area to expand a bit, almost like a tissue expander, and then come back in 30 days and have more room and more pliability. The third spot being the columella, where we can pull down and feel that there is room to place filler here to change columellar angle as well as nasolabial angle. So that's nasal pliability index, so kind of check that. Test in the dorsum, she's very firm, she has a hump, but we can't do much here because they left her bones spread rather wide. So this process today is going to be all about camouflage, rebuilding the middle vault of the nose in order to create a more aesthetic look. We want to fix the middle vault. I want to lengthen the nose. She's very shortened and we don't want it to look stubby. We also have to deal with the downward polybeak because there's too much cartilage here. So let's dive right into difficult rhinoplasty, which is like super danger zone. So you can close your eyes. We'll put it up at the very high bridge where there's bone, so it's still safe right in here, okay? And a little quick pinch, and the things I'm saying are not for you. You don't have to worry. Even if I say it's dangerous, I'm just teaching for Jody, okay? Every single thing is dangerous, so don't worry. Good. A little pinch. And so for me, I'm going to narrow her nose first. We're going to create more bridge height. Can you tilt your chin downwards for me? All the way down. There we go. That's better. And then always be on the lookout for bruising. If they start bruising, for me, see, there we go. That's a positive aspiration right there. And I was just going to say, when they start bruising, it means there's vasculature nearby. And so look at that. And we got that on video, and that is amazing. That right there is prevention. And I'm just going to hold pressure. If we get into an artery, there's nothing to worry about. You pull out, withdraw, but we tested, we didn't inject filler into it. And so you can throw that away. You can use that filler in some other area. Just say that we'll use it in her chin. But so with surgical rhinoplasty, we are going to encounter that once in a while, that the nasal bones, as they healed, and where there is a soft area, there's danger. And also, as we talked about in a previous video, the rhinion, where the junction of the bony dorsal bridge and the cartilaginous portion of the nose, that rhinion is got high vascularity as well. Sorry, my phone is ringing. Yeah, can you just send it to both? Thank you. So, two good teaching points there.
I've never seen that before.
Yeah.
But not in person.
Where's Carmen?
Over here.
My needle's bent. Can you do a fresh one? I don't know why they come like that, but you can just squirt it into another one. Okay, keep breathing. Ready? And then we're just going to adjust our positioning and go a little bit more lateral. And then, yeah, actually there is not cartilage here. So when I touch with my needle tip, I'm feeling like a void of soft tissue. So maybe her previous surgeon kind of took a chunk of cartilage there. So that is, you know, we can't tell. We don't have the op report. We don't have any idea what they did in surgery. So we're just going to be super careful there. That's why with liquid rhino we have to be cautious and then just understand the feel of your needle, and knowing where to aspirate is so important. And also knowing like what to not do. Like if you're a new injector and you really love liquid rhinos, you want to get good at it, you need to go take a course where you're doing cadaver dissections. And even better than that is you befriend a surgeon who does rhinoplasty. You go to the OR with them and you get to feel with your hands, with sterile gloves on in the OR, what things feel like when you touch bone, when you touch cartilage. You have no idea if you're just coming from the textbook and putting gloves on and starting. You need to have touched it in the operating room to really understand what you're feeling with the tip of your needle. So that's exactly how you should learn. You should be able to draw the nasal anatomy, name all of the important structures, understand all the angles. And you almost have to think like a surgeon to do the best work. So you have to think of the upper third of the nose, the middle vault of the nose, the lower third of the nose. What are the corrections in each area? So right now, she already looks better, and just because we've given her back a middle vault of the nose, the middle third of the nose has some presence where it's been missing all this time and giving her a very short, compressed look. And now we're going to work on her bridge. Now we're going to work on her tip a little bit more. Can I get another point too? And Christina, are you hanging in there?
Yeah.
Okay.
I'm gonna come up with abs tomorrow.
Cyberball.
You and me both. Summer abs comes complimentary. All right, let's do our little pinch test for where we have the most pliability. And actually, when I do this, I'm really just thinking of where can I create beauty? Where does the tip of the nose belong? And to get that 120-degree angle, I'm going to overcorrect it a little bit. I'm coming into the nose with a 45-degree angle. I'm hitting the lateral nasal cartilage and I'm skiving upwards and creating my own tip. I'm using filler as a cartilage graft. There is no cartilage graft in here. It's just filler, but I'm over accentuating how sharp the point of the needle you can see through the skin there. If I place a bolus of filler here, it's going to create this lovely definition, which will come down this much when the filler settles. Filler we place like a Hershey Kiss shape. It's a gel and then it settles down. Right? It looks very sharp for the first few minutes. Looks kind of awesome. And then it's going to settle down and look just right. And she has, like we said when we started, very firm and wooden tissue in this area of the middle of the nose. This has room for just a small amount. You touch and see, very, very lightly.
Mm-hmm.
Maybe there's a little pulse in there. Yeah, I definitely feel a little pulse in there. So we're gonna go high and go away from that and be aspirating everything and just be like, don't be a hero, just be so conservative. So now we're doing is just filling skin. And I'm including where I felt the pulse with my thumb.
Literally just enough to blend.
Barely, because filler's gonna, it's gonna spread, it's gonna swell, it's gonna do its own work, and then I'll check it again in a month. See, how often does that happen? Twice in one nose. So this was that kind of no man's land where we've placed some filler, we're right against the bone, and we're at the rhinion, and that's where she has had a lot of vasculature, either small form stuff or danger zone branch of the angular artery can come across through here. So I'm going to hold a little pressure right there, and that's a good sign to just stop. That's enough. We've put some soft volume, very conservative. Again, don't be the hero. And also, if you're someone who's new to liquid rhinoplasty and you haven't done like 200 of them, don't attempt these procedures where you're filling the lateral wall of the nose because it's just kind of not worth it. And I also train myself to want to sleep at night, so I don't want ever anyone to risk anything when you're watching this course. This is designed for expert, higher level injectors. If you've done 200 liquid rhinos, I can trust you to do this. You can work on the lateral wall of the nose. Otherwise, you're going to stay right in the middle. And please also remember that's not a danger-free zone. That's 15% of the time people can have aberrant anatomy that crosses the midline. Not every patient reads the textbook and grows their anatomy according to the diagrams. Okay, I'm holding a little pressure just so he doesn't have a big bruise right there. But I think overall, we have a nice improvement. So the nose doesn't look as stubby or shortened. The middle section of the nose exists now where it didn't before. Profile looks quite nice. The bridge looks thinner. And let's show you how that looks. All right, take a big deep breath. Are you ready to see your nose? Here you go.
Wow.
Looks so cute. Different. What do you like about it? She's speechless.
She's sweet. That's good.